and we're aiming to finish at approximately 6:30. Do by all means say hello to one another in the chat. You should have access to the chat and the microphone, and you'll need your microphone when you want to ask all the questions when we get to that stage. But please do drop introductions into the chat. So we've got the way we've set this up is we've got a speaking part first with John and myself, and then we'll have time for question and answer. Then we've got another section which is a little bit more detailed look at things, and then hopefully we'll have a time at the end for some more Q&A. So many of you will know who I am because BAPO have pushed out information about the project I'm involved with. And you may well have seen and heard, and I might have spoken to you related to other work that I've led on behalf of P&O. However, I don't want to assume, so let me introduce myself. So my name is Beverley Durrant. I'm a podiatrist by training. I've been working with BAPO for a few years now. I've got an academic and clinical background. I'm currently working on a project supporting the educator workforce. It's an NHS funded piece of work developing resources and supporting academic and practice educators. So today we're here focusing on our clinical and practice educators, and we're here to talk about the recently, or actually not so recently now, published AHP Educator Career Framework. And joining us for this discussion is Professor John Hammond. So I'm delighted to welcome John on this call. So John is Professor of Interprofessional Practice at Canterbury Christchurch University. John has a wealth of experience. He's co-chair of the UK National Association of Educators in Practice and is associate editor of the Physiotherapy Journal. And John has research interests in pedagogic practices and issues of social justice across healthcare, education and practice, including gender, sexual orientation, ethnicity, disability and allyship. And similarly, John's teaching interests centre on issues of social justice, specifically diversity, gender, reflective practice and interprofessional collaboration. So we're absolutely delighted to have you on the call with us, John, and for the duration of this webinar. So I'm going to get stuck straight in, if that's okay. And I know that you have been heavily involved in the development of the Educator Framework. So perhaps we can start there, and just by providing some context to our members on the call. And perhaps you could provide us with just a brief overview of the framework.
Thank you, Beverley, for that introduction. I think I should have made it briefer. I hate hearing things about myself. But welcome everyone to this webinar and the introduction to the AHP Educator Career Framework. As Beverley said, I have been involved in probably in the latter stages, more recent stages in terms of the implementation of the framework. The framework was developed and launched in 2023, so over a year ago now, and was published by the Council of Deans with support from NHS England. I was not involved in the development of that, although the National Association of Educators in Practice provided some advice on final drafts, which I was involved in. Anyway, to summarise the framework, what the framework is developed as an outcomes-based framework. So to help provide outcomes for the knowledge, skills and behaviours required of an educator, and an educator in multiple settings. So in formal settings like higher education, but also in other settings such as in practice and in roles that we might have in very different ways. So facilitating learning, supervising, being a role model in our practice as allied health professionals. So it provides outcomes that individuals can look at to help structure their careers. But it is also helpful for not only for individuals, but for line managers supporting colleagues in helping to shape and structure their education career pathway, but also for organisations to consider how they might consider training and development that is structured around to support allied healthcare professionals' training and development. So I think that's the main overview of the framework. It's there to provide guidance and support and structure to celebrate the education pillar of practice alongside clinical research and leadership. So this is filling that gap because we've got a bit of work in all those other spaces, but not necessarily in the education pillar. That's a summary so far.
Lovely. Thank you, John. I really like the way that the framework is so inclusive in that no matter, right from a learner or an apprentice right up to being a consultant AHP, there is something in it for everyone, isn't there? And I think that really comes across strongly. What would you say, John, are the key highlight messages that are really at the heart of the framework that might serve our educators well?
Yeah, I think the key messages are let's celebrate education and our role as educators. I think that's one of the key messages. And also, as you mentioned there, Beverley, I think it's really important that actually we think about that role right from the stage when we begin our journey or when learners begin their journey in pre-registration education or through apprenticeship, right through to those in senior academic positions, but also in affiliated roles, so in support worker roles as well. So I think the framework really does provide the opportunity for anyone who is an allied health professional to kind of see how education may be a part of their practice in rather more obvious ways and coherent ways than perhaps, oh yeah, it might be nice to do a bit of education. It might be something I do over there, but it's not part of my practice. So I think it's really kind of beginning to centre it as part of practice. And what else do I think? Yeah, and colleagues have told us that often when people are doing roles in education, that often the training and development or support is often a bit of a scattergun approach where we kind of, oh, I'll do a bit here and here and here, and then somehow it comes together. But I think having the framework helps to provide things to hang stuff off. So that we can kind of say, oh, when I did that, that probably links to here, or, oh, I can see how the framework suggests these things are important. Maybe I need to do a bit more development in that area. So it kind of is a helpful and supportive framework, I guess, in that way.
Yeah, and so much in everything you've just said there. And I think some key kind of things to let the audience know about are some of the resources that are already available via the BAPO website. So one of the things that we're doing, which isn't published yet, but one of the things we're doing for this piece of work is to pull together a library of resources for educators. So So the framework will be kind of the central piece, but then we'll have lots of other resources, some of which are already out there, but people just don't know about. And some will be new resources that are developed as part of this program of work that's happening right now. But I love the way also that we're talking about the full expanse of the P&O workforce here, and some of the publications for the last year for the workforce reform NHSE funded work included a support worker framework, which does have the 4 pillars embedded within it, and also the practice-based learning framework. So both of those are available on the BAPO website. I think it's under the resources section, but we'll make sure you get all of the relevant links. But I think that's exactly what you were saying there, John. It's all encompassing, and it really needs to celebrate everyone's contribution to education. So, anything else there, John, that you'd like to add?
Perhaps I'll just share in the chat just to make sure that people kind of can access.
Brilliant. Okay, there you go.
People can,
so
yeah.
Have a look at it in real time as we're going through this.
Yeah.
So I guess that kind of links in really, John, to the transformation that the prosthetic and orthotic profession is going through in lots of areas of education and practice. And one of those key areas is to grow the number of registrants. And of course, if we want to grow the number of registrants to the profession, that also means that we need to grow the pipeline of students and learners. So given those challenges, how do you think the framework can help in trying to achieve that challenge?
Well, I think, first of all, the framework can help by using it, promoting it from an early stage in pre-registration education so that it's visible, individuals are made aware of it, of the possibilities of those pathways in their career. I think for colleagues who are in early practice, recent qualification, or in early years of practice, it gives some clarity in terms of the opportunities that they may have to support learners, to look at evidence-based practice in terms of teaching and learning and supporting and facilitating learners. So it might help to shape CPD opportunities for individuals, and it might help to shape the kind of learning within practice. And then finally, those that are in those stages of their career where they're thinking, oh, I need to think about how I'm going to shape learning and curriculum on a wider scale, then it provides the opportunities or ways to see what they might be able to do in the future. So I think it does have the potential to support the transformation in the workforce and the need to grow the P&O workforce, because I think it provides legitimacy, validity to education alongside all of those other pillars. Because I think education often gets seen as in the back seat or something you do on the side. I think this brings it into an equal playing field in terms of those pillars of practice. That's my perception. Others might argue with that. Beverley, you might have a different view, but that's my view.
Yeah, no, I think that's really interesting, and I think it's actually worth pointing out that one of the things the framework is designed to do is to highlight that education career pathway. And I think, you know, that kind of can't be highlighted strongly enough, because I think, you know, it's often seen as a sort of separate kind of career, but actually there's two elements to this. If you look at the number of clinical hours that are embedded in practice-based learning activity within a pre-registration course, it's a huge number. You know, and we know that our prosthetic and orthotic learners, whether they are traditional route students or whether they're apprentices, you know, well, apprentices, all of their learning is in that setting. But for our traditional route students, they do, at the moment, they do long block placements, and you add up those hours, and it's quite a chunk of the course. And I remember when I decided to kind of try and change my career direction, and I went from clinical practice into an academic role, and it really felt like I'd had a career change. It really was light years away from you know, what it's like in clinical practice, and I think there is that gap that needs shrinking there, which I think the framework can potentially facilitate a bit of that. And I think it's quite interesting in the work that we're now doing with this commission piece of work, that the educator part of it is looking at both clinical and academic. So I think that kind of like potentially sings to that need to kind of bring awareness to the role and career journeys and pathways that people can take if they want a career in education. And it doesn't have to be in higher education. It can be in your workplace. And I think that's the key thing. This is very geared towards a clinical setting, as much as you could equally use it in a higher education setting.
And I was probably
go
just going to add that as part of the implementation work that we're doing, we're trying to develop a website that is more interactive around the framework, that gives practical examples of how to kind of use the framework, and also has vignettes or some case studies from individuals that have used the framework. And what we're hearing is that people are using it through appraisals. It's validating the things that they were doing, and often in those transition spaces that you talked about, Beverley, where people are doing something in their clinical role, but then they're also doing something elsewhere, and therefore they're kind of juggling the two. But it gives legitimacy to have those two opportunities and celebrate them.
Absolutely, yeah. Okay, so we're just going to take a little pause there and just open the floor for any questions that anybody might have. So you should all have access to your microphone. So I'm just going to get my list of people up so I could actually see whose hands might be going up. So does anybody have any questions for John or me at this stage? Hey.
Hi, Bev. Hi, John. It's interesting to hear what you've just said there, Bev, about having a diverse experience in prosthetics and orthotics. If we're going to keep people in this profession, we need to offer them a variety of professional development and career experiences. One thing that I find really interesting is that as AHPs as a whole, and not just prosthetists and orthotists, I feel like we're treading a path that nurses have already trodden, in that they're moving, and they've done it really well, from their clinical roles into academic and education roles. And I was reading around the research of the barriers that they faced, and they're very similar. And I think we can learn a lot from our nursing colleagues. And one of them is that, and we have this now, is that if as a prosthetist and orthotist, you're not doing clinical work, you're almost not doing your job. And that is something that they felt, and it made them feel like imposter syndrome. And I think that narrative has to change. And I wondered what your view was on that.
Yeah. John, do you want to go first, or shall I jump in?
I'll follow you.
I think that's so true, Nikki, and I think it's absolutely fascinating. But hopefully, by embedding the 4 pillars of practice in every stage, even support workers can experience working across all 4 pillars. And I think if we can bring that down to a level that becomes, this is what the role's about, and these are the opportunities that are out there for you to diversify your career. I think we've just got to keep chipping away at that, because we're now building the resources. We've got the support worker framework, we've got the PBL framework, which both have the 4 pillars embedded. We've got the career framework, which also sings to that. And I think there are so many opportunities and such a lot of information out there that I think part of our job is to try and bring all of that into one place and show people what's possible. Because, if you're in a clinical role and you're there doing that every day, and you don't necessarily have your ear to the ground about all these other things that are going on, it'll be very nice to be able to just go to one place and say, okay, look, I want to do something different with my career, or prepare, like, as John was saying, preparing for, annual reviews or something, being able to look at all of that stuff and say, actually, I'd like to do a bit more of this, or I'd like to expand in that area, or what can I do to expand in that area? I think we just got to keep chipping away. And I think if the professional body is behind it, that is a huge step in the right direction. And I think, if we continue with these engagement events and the networks that we're developing, I think it will come, but obviously it takes time.
And I'll just briefly follow up before Andrew. Nikki, I really hear you. I think that's something I've always felt as well. We're always a step behind our nursing and midwifery colleagues and our medical colleagues as well. But I think I might flip that a little bit, because actually we're ahead of the game in terms of AHP, because the nursing and midwifery colleagues are developing an educator career framework now. So
we're ahead of the game in that respect. That's good to hear.
So take that as a celebration. And in fact, I've had a look at a preliminary draft, and I think I don't know, maybe I'm biased. I'm happier with the AHP one. But saying that, I think the framework can help us with a lot of some of the challenges that we've been facing, because you might be aware, and I'm very aware, of the very different language of different educator roles. There's a survey that one of my colleagues did at NHS England, looking at the number of labels that there are for people who hold educator responsibilities, and they found that there was 75 different labels for these roles, whereas in nursing and midwifery they're a bit more streamlined, and there's a clear pathway through clinical practice, at least from the director of nursing right through. So we've got to, I think the framework can be helpful in that way, because I think we can help to drive the importance of education in allied health professions, and it'll help to drive that infrastructure as well. So using it, I'd encourage you all to kind of take it to your employers, bring it to the table and say, how is this being informed? How can it be embedded within policy, so that we kind of influence things at an organisation level, as well as Beverley said, through the professional body as well.
Lovely, thank you.
I just pick quickly on just the response that you had, Bev, because I think that's really important about the 4 pillars, and keep talking about the 4 pillars, because That's a misnomer around advanced practice, that we need prescribing rights to be advanced clinical practitioners when we don't. But what we do need to be doing is working across the 4 pillars. And I think that's a really important thing to understand.
Yeah, thank you, Nikki. Thanks. Okay, so Andrew, we're coming to you next, and then we're going to move us along in this webinar. So off you go, Andrew.
Yeah, I think there's a lack of opportunity. I mean, I work as an advanced clinical practitioner in orthotics. I specialize in scoliosis treatments, and I've done so for 30 years. And I'm heavily involved in research. I lead the Conservative Care Day every year at the British Scoliosis Society. And, you know, I submitted, along with my colleagues, 14 abstracts last year and got 10 accepted. And I'm busy. And the problem is that nobody else does. Every year, I have the pain of trying to encourage my colleagues to write, submit abstracts and do stuff. They just don't seem to have the time to do it or the inclination to do it. Whether they're in the NHS or in private companies, they really struggle to get involved. And it doesn't seem to be an expectation that there's anywhere to go, that there's a career structure, a clear path for orthotists to develop. I've done it myself, just through hard work and working with some very supportive consultants over the years, and had very close working relationships with universities. But it's exceptionally rare. You know, I'm just trying to recruit another orthotist to my team, and we only work treating scoliosis. That's all we do, nothing else. So it's pediatric scoliosis treatment. And all of my team are involved in research and education as well as clinical practice. And when I've tried to recruit people, and they say, well, what am I going to do every day? I said, well, you're going to do a couple of days of clinical work, and the rest is going to be research and development and education. I wouldn't know what to do. And they just don't seem to understand that it's huge to try and get up to that next level and really be part of the multidisciplinary team that I work with very closely with consultants. We discuss cases every day. I am able to prescribe, to request the x-rays or read the x-rays. I screen a lot of triage, a lot of the patients, and advise the consultants, this patient is suitable for bracing. It's go ahead, do whatever you like. So although I can't directly prescribe, I can under the auspices of the surgeons there. But the rest of my profession is not keeping up, and something needs to change. I don't know what it needs to change, but I think that the way that technology is advancing, and the way that, you know, the treatments are advancing in our field particularly, we need highly qualified clinical specialists, and they need to be operating at a much higher level than they currently are. And I feel frustrated that I can't find people or even convince people to do it. So that's why I was very interested to listen to what you've got to say, because I think we need a framework, we need a structure, we need something to be able to say to people, you can do this, and this is where you can get to.
Exactly.
And I just feel it's been lacking for far too long.
Well, let's hope, Andrew, it's all about to change. And so I'm gonna give Nikki the last word, because I know that there's something coming up that she might. I don't know if I'm jumping the gun, but I'll hand over to Nikki in a second. But just to say, Andrew, that I may well come knocking on your door to do another one of these webinars so you can share your enthusiasm. And thank you for your contribution, very valuable. Nikki.
Yeah, I absolutely agree with you, Andrew, and there isn't one solution to it, but we are working on several strands to answer exactly what you've just said. So let's talk about some of the things that are a barrier to that. The first thing is the contracts. The contracts are clinical based only, and if we don't change that, then nothing else we do is going to work. So that is a big stream of work that we're doing. We have to make the commissioners understand that there's more to prosthetics and orthotics than just seeing patients. We work across the 4 pillars of practice, and we have a profession that wants careers across the 4 pillars of practice. So we have to embed that within contracts. So that's the first thing. The second thing is empowering and educating the profession to understand what advanced practice is, and to understand that some of these things, like for instance, research, is not an added extra. It's actually what you sign up to every 2 years when you sign up for your registration at HCPC. And the standards of proficiency have changed. It's no longer to be aware of it, it's to demonstrate that you're doing it. So again, we've got information coming out around that. And in terms of research, we've got a guide coming out in the next couple of weeks, because research has to start at every level. And that means we have to include our students, our apprentices, new graduates, prosthetists, orthotists, support workers, technicians, to share their information. And maybe the first step of doing that is poster presentations. And we've got a guide coming out in the next couple of weeks to tell people how to do that and empower them to take that first step into research. And that research doesn't have to be a peer-reviewed publication. It can be quality improvement. That's an early research skill. It can be audit. It can be evidence-based practice. There's a whole load of information that we have to empower the profession with to take that next step and put us in line with our AHP colleagues. I don't know if that's what you was expecting, Bev, but
Yeah, thank you, Nikki. That's brilliant. And hopefully, Angie, that's given you hope, and stay with us, because we're making strides in the right direction.
absolutely.
Okay, so I'm going to move us on a little bit, because I'm just keeping an eye on the time. So in this next section, we're going to move into a more detailed look at some of the domains within the framework. So I'm not sure how many we're going to have time to cover, but there's 3 that we thought perhaps might be particularly useful to gain an understanding on. So domain 1 is about responsibility and accountability, and that's geared towards ensuring safe and effective education. So I'm going to hand over to John. What can you tell us about this one, John?
So I've just put the framework up on the screen so you can see that now. So domain 1 is responsibility and accountability, and we'll talk about some of the others as we go through. So really, within responsibility and accountability, there's a number of elements that in the framework, I will scroll. Hopefully you don't get seasick as I'm scrolling up and down on there, but I just wanted to help you navigate the framework as it is now. So responsibility and accountability to ensure safe and effective education. So it's not about practice, it's about education. So about retaining overall responsibility for pre-registration student and apprentice development. So this is a practice educator thinking about how they're taking responsibility for their education in practice. Takes part in peer-observed teaching and other education development, participates in regular peer review, completes comprehensive session plans for education activities, and adheres to principles of inclusivity, anti-racism and co-production, and keeps appropriate records. So that's how they're listed as elements. So they're elements or required outcomes to demonstrate. And the framework also, now I'm going to scroll down, so be careful, you might get a little bit dizzy. The framework also relates how that is important for each stage of learning. So for a student, that there's responsibility on each of those to consider. And then as a senior academic, they have responsibility for the 4 areas here to demonstrate those. So it helps in terms of structuring that and thinking about how people are responsible for not only updating their clinical practice, but actually thinking about education and how they're involved in education practice and have a responsibility for that. I'll stop there.
Thank you, John. So I just wanted to pick up, John. So the domains, so there's 6 domains,
Yes.
and then there's also 6 guiding principles. And are they? What's the relationship between those 2?
Well, the guiding principles were the guiding principles to in the development of the framework to shape how it was considered, and then the domains of the outcomes. So what is expected then? So one of the guiding principles for developing the framework was people first, thinking about the individuals first, whether that be service users, whether that be learners, in the context. Equality, diversity, inclusion, and belonging was something that was foregrounded by the development team in thinking about this needs to be centered within education practice, throughout practice. So that sort of thing is what's driving those principles and then the outcomes.
Yeah.
Does that make sense to everyone in terms of?
That does to me, and I think that was probably helpful to explain that. So thank you for doing that, John. Okay, so hopefully you've all managed to access this. If you wanted to follow what John's saying or what he's got up on screen, you can see it on your own computer. The next domain then that we wanted to look at was around domain 2, which is diverse and inclusive leadership. And this is looking at overcoming barriers and providing solutions for the provision of inclusive education. And what I really like about this is that, we're talking about the 4 pillars of practice, and we've also said that this covers a whole spectrum of roles, right from learners and students up to consultant practitioners. And so also embedded within this is the ability to kind of be able to expand the scope and reach out to those other pillars. And I think this is a great example, this domain, of how that is possible for the leadership pillar. But I'll let you go on and give a little bit of explanation around that, John, if you don't mind.
No worries. So again, this one is similar in the structure, in that there's a number of different elements or outcomes that are expected within that domain. And what this shows is those expectations and how they might be relevant for different stages of learning. So from student learner right through to support worker, early career, graduate, right through to senior academic. So in terms of the very first one, contributes to creating an inclusive learning environment, a relevant outcome for any person involved in education. So it could be something that individuals try to demonstrate how they've contributed to creating that environment. That could be students, that could be early career graduates, that could be a senior academic. Whereas something like develops and promotes a diverse and inclusive learning environment, the values and support staff and students across. Well, I guess this one is more relevant for those that have a responsibility across a wider network, whether that be academics in an education environment responsible for thinking about how their team is developing in terms of diverse and inclusive practice. So we'll be thinking about that and how education practice is developed. And there's kind of a curriculum design, there could be that within academic setting, but within practice setting, it might be how are we all kind of thinking about our education practice and how am I influencing my colleagues? So it's thinking around that. And there may be colleagues within prosthetics and orthotics, but it might be a wider team. It could be beyond that boundary. I hope I've made sense there.
Yeah, no, it's so interesting, John, because there's so many kind of interconnected areas here. I'm just thinking, if you're a clinical educator or a service manager and you're thinking about putting together an experience for a learner, there's so much here where you can, I'm thinking about the PBL framework that has the 4 pillars in it, and is embedded within, and quite often I hear conversations about, well, how can learners be leaders, and as Andrew was saying about, getting our profession behind research and innovation. And this is a great example of just how that could happen. So it doesn't have to be, far-reaching leadership roles. It can be, sharing good practice and sharing with colleagues, or demonstrating inclusive leadership from a learner perspective, can help, provide that foundation for leadership in their career. So, yeah, really fascinating. Thank you, John, for that.
Perhaps I should add,
Yeah.
I know the framework does kind of indicate, wow, as a consultant practitioner, you're responsible for that, or a senior academic. But what we've found is that is a guide, but it's not restrictive. It's meant to be indicative of who might do that, because we've had conversations with colleagues, and that will be part of the framework too, who might be early career graduates, but have done quite a significant amount of work in this space. And they may have a strength in this domain too, but have other areas where they need to develop. So that provides the opportunity too to kind of think about where people have a strength and where they have areas for development.
Yeah, thank you, John. Okay, so I'm just doing a quick time check. So I think we've got time for just one more, John, if that's okay. So if we move right to the end then and look at domain 6, which is research, innovation and quality improvement. So this is to ensure that education provision is evidence-based and impactful. So what can you tell us about that one, John?
Yeah, so this picks up on what you were talking about before, Andrew, and also Nikki, in terms of thinking about research. And I think here what a driving principle is thinking about teaching and learning, and thinking about the evidence-informed practices of that. Not just evidence in terms of clinical practice and that driving the teaching and learning, but actually what are the pedagogic evidence for designing a particular education approach? What are the principles underlying why we do something in a particular way? So understanding what facilitates learning in a more effective way. So there's a number of different elements here that actually considers how an individual might look at an education program, whether that be in practice, a training and development program, and the word critically evaluate. So trying to explore how effective are you being in the way you're delivering training. How do we know the outcomes are most effective for the learners? And that can be within practice, but it can also be within education and formal educated setting. And then there's other things around those outcomes. So looking at outcomes, how do we assess the outcomes and try to analyze evaluation mechanisms for themselves? So we might do a survey at the end of a training session. How useful is that? We get a lot of people saying, oh yeah, that was great. But there could be a critical evaluation on, but does it change their practice? So it's those sort of things that are within here that have higher expectations for those in more senior positions and in an academic sort of context to consider. But then, of course, participating in the quality improvement projects, engaging with that activity is an expectation for all within practice, within the education pillar.
Exactly. Yes. Thank you, John. Okay. So here we are. So we're going to move on to the Q&A. There is another question I'm going to come back with you to you in a minute, John. But let's just open up the floor to talk about those domains. So, Andrew, I saw your hand flash up, and so do you want to come in?
Yeah, I just looking at the last one and critical evaluation and really, thinking about what you're doing, it kind of very much reminded me of when we started the BASIS study, which is a multi-center study across 22 sites in England, where we're looking at clinical outcomes and we're looking at comparing part-time, nighttime bracing against full-time bracing to see if there's an equivalence of the two. And when we were producing the protocol and we were getting everybody to sign up to this, to join in the study, one of the biggest resistances was taking in-brace x-rays. They didn't see the need for in-brace x-rays. And I was just astonished at how many places did not do it. They've all signed up to it and they are now doing it, but you improve your outcomes hugely if you look at what you're doing and critically appraise the fit of your brace and readjust it according to that radiological information that you've got. And there's been numerous studies published that show that not taking in-brace x-rays reduces your success fourfold, or increases it fourfold if you do take x-rays. And yet, in 2022, I was still fighting with consultants up and down the country, an orthotist that didn't see the need to do it. So, this is how far we need to go in terms of changing things, because to me, that is common sense. Why would anybody not? You wouldn't implement a treatment and then not check if it was working. Why would you not do that?
Yeah, well, that's great detail. Thank you, Andrew. I'm going to come back to John because I think you want to come in there, John.
Sure. Yeah.
And I think, so Andrew, I think that's a really good clinical problem, isn't it? What do we do about evidence-based practice, and why do people not use evidence to inform their practice? But in terms of the educator framework, we could think, why is it that they're not following the guidance I've given them? Yeah, what is the education reasons for that? What would facilitate them to learn that more effectively? So we're looking at the pedagogic reasons why people do things and why people's change behavior, rather than looking at the evidence per se in terms of clinical. So that would be a really nice thing for you to critically explore and think about how the delivery of that information might be better received by those colleagues. Does that make sense when I'm saying that?
I know, I understand exactly what you mean. It's just, you get there eventually. And I think that getting involved in big studies raises everybody's standards. It's really changed. We're 2 years into this now. It's really changed the way people practice. So, I think, research needs to be part of everybody's practice because you learn so much from it.
I think there's two things in there, isn't there? Because you said, when you started off, people weren't using it, but actually you've demonstrated through this, and you said that people are now on board and doing it. So you've obviously had an impact with your research. So that's one thing. But I think some people are quite frightened of getting involved in research because it seems like something that they don't have the skills for, or it's not part of their role, or they just don't feel that they're, it's that whole imposter syndrome thing again. So I think there's a lot of truth in what John is saying, is to try and, what other approach can we take? Because you do get frustrated as a clinician, why is this so slow to change? Why isn't it happening? It's obvious to you, but it's not necessarily obvious to everybody. And I think to try and find alternatives is really helpful. And I'm actually really looking forward, Andrew, perhaps if you and I could get together and kind of work something up that we could maybe consider how we could reach out to a wider audience on this sort of thing. I think that would be really useful. So thank you for your input, and I got your name noted, so you won't be getting away. Right. Okay. So any other questions from anybody else at this stage? No. Okay. So I'm just looking in the chat. So hopefully, Amy, you're seeing. So Amy's put a question in here about how can it be rolled out on a practical level with the demands of clinic, with very little time for development, focused purely on getting patients seen due to staffing levels. Yeah, I mean, that is something that I think everyone's acutely aware of, but I'm really hoping, Amy, that you're seeing how things might be kind of shifting through the conversation that you're listening to this evening. I mean, has anybody got some successes on the call that they could share that perhaps will encourage Amy, sorry, not to give up hope? Yes. So, yes, right. Okay. So we've got two hands up here. So, Tanja, sorry if I'm not pronouncing your name correctly.
Hi, yeah.
Hello.
It's so we're just kind of starting implementing data collection to evaluate the effectiveness of orthotic management within clinical practice. And that came from attending one of the outcome measure talks that was on, I think, earlier this year. Is it with Tom Cadwell it was? I can't quite recall. And he was talking about kind of like starting simple with implementing such as Tom's outcome measures or just simple outcome measures into clinical practice. They can be really, really not time consuming, depending obviously on how much clinical time you have. But if you've got 30, 40, 50 minutes, and just to start collecting data, it can happen. So we've started to kind of implement it into clinical practice, which we're really at the start at the moment, but we've kind of set everything up to start with a small cohort of patients. So I think it can be possible. It's just getting everyone involved and getting the team involved in doing it and discussing it. What are we going to do? Which patients are we going to have in that cohort, and what are we measuring, and what do we want to evaluate from that measurements? So that's kind of like what we currently do.
Lovely. Thank you so much for sharing that. And I think, that's definitely a key message, isn't it? Small steps, and every little step helps. Okay, Barry, I'm coming to you, sir.
Hi. So Amy's asked about how big companies are going to cope with this and how they are doing with it. So I think one of the drivers for the big companies is the apprenticeship. And as Nikki said about the big barrier to us having time to do it is contracts. But what we're trying to do is we're trying to influence because of the lack of P&O staff coming in and graduates coming in, and trying to push the apprenticeship. We're then having discussions with the NHS to try and show them that each of the practice educators needs more time to be working on this. And I lead the training throughout Steeper Group, which is one of the bigger companies. And what I'm trying to focus on using the framework is that you have a practice educator, but everyone that's involved in the apprenticeships or with graduates within the team needs to have educator training as well and needs to be involved in this framework. So that's one of the things that as a company we're really backing now. I don't know if all companies are doing that, but I would hope so, because I know that other companies are taking on apprenticeships, and hopefully they're using it as a time to push back on the NHS a little bit and say that we've got this lack of skills that we're coming through. We're using apprenticeship, and you've backed apprenticeship, but you need to give us a bit of time for that as well.
Lovely. Yeah, Barry, thank you so much. That's such a valuable contribution. I think it's really important You know, it's a work in progress, I think, for sure. I'm just looking at the time. So we're on 25 past. So our time is almost up, John. I don't know what happened to that hour, but it's flown by. So I wonder if in the next few minutes, if we can summarise what might be coming up next with regard to the Educator Framework, the next stage development, which might help embed and land the framework. And then I've just got a little plug at the very end.
Yeah, so NHS England had some money to help with the implementation of the framework. So regionally, people have done things differently. Some have put on events, kind of not dissimilar to this, but others have kind of done things where they might have kind of showcased some good examples, a little bit like what you just talked about, Barry, about how people are starting to think about it in an organisation. What we are doing and what we've been developing is an interactive online framework, so that rather than just being the PDF that you can see online, there's some guidance about how you might reflect on particular areas within the framework and some examples of what people have done. So that might be helpful to hear what others have done and how they've used the framework to support their learning. So that's due to be launched in September. So we'll share that with you. But if anyone on this call has engaged with the framework and really would like to share their story, we'd be very willing to hear from you, because currently there are no prosthetic and orthotic colleagues represented in terms of giving examples. So we really want to kind of hear from you. We have a few from other professions, but prosthetics and orthotics, we don't. So if anyone wants to chat, come to me.
You can't refuse that offer. We want to see it bulging with P&O colleagues. There's a great opportunity. John, thank you so much for that. So we'll make sure you get all of the relevant links and how to contact John to get involved. And please do get involved. And I think perhaps there might be a follow-up webinar at some stage about this. I would just like to highlight, so there's lots of information now going in the chat, so make sure you pull off anything that you might like to. So there's bits in there about leadership, webinars coming up, and one or two other things, so have a look at that. And I would just like to say a huge thank you to John for joining us. I think you've been so insightful and really helpful. And everyone on the call, if you would like to stay in the loop with everything that we've talked about today, and we want to make sure that this facilitates, this is, you know, all of this is designed to help. So one of the things that we are setting up, as I said at the beginning, is an educator network. So if all of you on the call or your colleagues that weren't able to come this evening would like to be involved in that, that's another thing that you can get involved with to keep up to speed with everything that's going on and help build this resource that we want to achieve with this, the work that we're doing. So I can't thank you all enough for joining. We've had a fantastic turnout for this. And as I say, we will be doing some follow-ups, and I will connect with Andrew about one or two other things. And thank you so much for joining. Very much appreciated, and watch this space.
Thanks, Thank you, Bev. Thank you, John.
Thank you.
Thank you.
Very welcome.
Thank you.
Thank you.
A couple more things in the chat, Bev.
Okay, yeah, I'll make sure all of that goes out as well, Nikki. Thank you so much for putting all that in there.